Good morning, everyone. We'll get started here in just a minute. All right. Well, good morning, everyone. I've got 9 o'clock, so we'll get cranking here. Thank you very much for being here. It's another fantastic Monday morning here at Health Plan Markets. It is December 16th, and we're in the midst of closing out the year 2024. We're working on 2025. But as normal, we are here to improve the lives of our community with affordable healthcare. So thank you for being a part of that mission. And thank you for continuing to be on these calls. Even during this awkward time of year, I'm sure many of you have in-laws and outlaws coming into town and you're hosting, or maybe you're traveling a bit. Very much appreciate your time and attention this morning. We are going to be doing the rest of the Mondays for the rest of the year will be open. So I do plan on continuing these calls, just so you know. We have learned that we can live stream these on YouTube. So if you do get busy, just know that these videos are going to live on YouTube as well. So if you haven't yet gone out to YouTube, subscribe to our channel so that way you're notified when we're doing these videos. So there it is. As we normally do, we have to keep one foot in the classroom and the other one in the field at all times. And so I'm going to share my screen here with everybody. And you should be able to see what's going on here. So we've got HQ here. If you've logged into HQ, we do want to make sure that you're aware that we've got a new demo system that's happening, which is pretty cool. So if you're new to HQ, you can check that out. If not, you can close it out and then explore how you normally do. But on the left-hand side, we go to learning and the training calendar here. So once you click the training calendar, it should give you all of the great things that are happening across the industry. This is the week of the 16th. One thing I do want to point out here too, in the top right corner, you can select just the week, so you can see like a weekly view of what's going on versus the whole month. So if that's a bit easier for you, go for it. I'm not going to go through all the trainings this morning, but I do want to point out a couple of important ones. Aetna's doing a retention training today at 10 a.m. and they're going to go through OEP, open enrollment period for Medicare, and lock-in. So very important training. If you're feeling a little loose on that, great training for today at 10 o'clock. Tomorrow, you've got ACA consent and compliance at 3 o'clock. Tomorrow, if you're doing ACA training, this is a fantastic training to know and to learn what's going on there. Moving over to Wednesday, our very own Al Clancy is available for a virtual coffee and chat. We want to make sure that that you're there and and you connect with Al, because he can be a great help for you there. Also on Wednesday, United Healthcare is doing a training at 1 o'clock on Wednesday for their chronic condition plans. Very, very important, especially for those folks that have diabetes. We have a special guest that's going to be talking about that today. Moving over to Thursday, we've got WellCare coming in the office at 9 a.m. at our Edgewater office, so check that out. Appreciate you guys coming and seeing that. If you're unfamiliar with HQ, a great opportunity for you to learn about that on Thursdays at 3 o'clock. This is our all-in-one agent portal system. Appreciate that. And then Friday the 20th, we've got What About Shop with Tom Ryan to to get the 2025 updates on your HPM shop and all the good news that's happening there. So those are the highlights for the training. Remember, you can get all of the trainings in HQ under Learning and click Training Calendar there. So it should be pretty easy for you to navigate to get in there. So that's a training for the week. Remember, keep one foot in the classroom and the other one in the field at all times. I also wanted to share with you guys what's going on with HQ specifically. Let's see here. This is training calendar. There we go. So we have a couple of updates on the pages. We're continuing to obviously make this better and better as we move forward. On the homepage, don't forget that we have all the major blogs that are there that we've written that give you the latest and greatest on what's going on in the industry right on the front page, so you know what's going on. So I did a Medicare Advantage commission update last week, and so just a little simplified version of digesting that. You can also find all of your commission information on the left-hand side. We're continuing to update that. And I do want to ask is if you have any suggestions, this is your time to make HQ better. So at the top right corner, you can click feedback and you can leave some feedback on HQ and let us know how we can improve this for 2025. We don't know what we don't know. So your feedback is crucial in building a stellar product for you guys to use. And we want you to take full advantage of that. All right, we see here. All right, so next up, we've got ACA. There was an announcement that was made late yesterday about an extension that's happening for the marketplace. So here is the deal. If you go to healthcare.gov, the marketplace is extending the January 1st enrollment date. You can enroll people up until December 18th at midnight. So that gives you guys today, tomorrow, and Wednesday to track down some last minute folks that maybe did not get a health plan in time or didn't get back to you in time. You've got 3 additional days to get them in for January 1st effective. Okay, so this is for ACA, individual and family plans. Please make sure that you reach back out to your leads, your customers, your clients, and you can get them enrolled today, tomorrow, and Wednesday. So you have an extension there. Beyond that, you also have special enrollment periods, and this should be your cheat sheet for the rest of the year. So what I'm going to do is in the chat, I'm going to post the healthcare.gov special enrollment periods, but I want to go through that just very briefly this morning to remind you that, you know, if somebody does miss the open enrollment period, let's say they don't get back to you till Thursday, you can still get them enrolled for January 1st if they have a special election period. Now, in most cases, the life event or the life change that happens in the IFP business has to happen within 60 days. So in the past 60 days, did any of these things occur in your life, which would open up a special election period for you to enroll January 1st, okay? So life changes include they got married, they had a baby or adopted a baby, or maybe placed a child for foster care. They got a divorce or legally separated and they lost health insurance. Someone in the family died that was on the policy. That also creates a special enrollment period for the rest of the family. If there's changes in residence, if they have a new zip code or county, if they've moved from out of the US and they moved back to the US, remember they have to be legally here, okay? So that's a thing. You move to or from a place you attended school. So let's say you're a student and you moved to a new city. You know, you were placed with both live and work, or you're in transitional housing. So all of those are SEPs. If you lost health insurance because you lost your job, changed jobs, it got canceled, maybe somebody qualified or lost Medicaid, maybe somebody in the household got eligible for Medicare, maybe you're out there and you're helping a T65 person and maybe the spouse is still under 65, that's going to open up an SEP for that spouse for ACA coverage as well. Employers, this is a little bit more complex because now we have the health reimbursement arrangement, and I'm not going to go into details about this, but this is a great resource for you guys to learn and understand how this impacts folks. That's another way that people can qualify for health insurance beyond December 18th for January 1st effective. And then more qualifying changes, the Alaska Native, if you run into one of those, you become a U.S. citizen, you're leaving incarceration, you got in or out of the military. There's a lot of different things, and including government disasters. So things like hurricanes, earthquakes, those are things that do qualify for SEPs. Just pay attention to which carriers are listed there. And on the application, when you go through the application, what's great about using Health Sherpa is it kind of gets you to that section and it asks you these questions. So if you're, keen about it, the first thing you should really be doing is, when can this person enroll? And the name of the game is find that SEP. Find that SEP. If you can find the SEP, you've got a new client. Okay. Now, what happens if they don't have an SEP and they miss December 18th? They can still enroll in health insurance, but it won't become effective until February. Okay. So we're still in the open enrollment period all the way until January 16th for a February 1st effective. As it stands right now, we might get another extension. We don't really know. What prompted this extension? Well, from what I see, there is a very big gap in health insurance coverage year over year. Not many people are coming back to the marketplace, and they're concerned about the numbers. So I think that's why they extended it. That's what I'm seeing and hearing and reading. So they want more engagement from those folks. So that is happening. So right now, for ACA, we're supposed to be in a mini lock-in, but we've got this little extension here that's happening to Wednesday, and then we'll be in lock-in as well. So that's why I wanted to point out these SEPs for ACA. And I want to shift to Medicare very quickly. And there is a whole page on the Medicare SEPs that I'm going to drop into the chat for you guys as well. This is under their Medicare basics, but look at all these SEPs for Medicare, just unreal. There really shouldn't be an excuse to not find an SEP. So, if you moved, like we talked about before, change of address, change of county. Now, if you move counties, what happens is you have a whole new set of plans available. So that's why you get an SEP. So there's different timelines around these things. So that's why there's drop-down boxes, so you can get the full picture of what's going on with these SEPs. If you had a chance to get other coverage, if your plan changes its contract with Medicare, other special situations, you've got tons and tons and tons of SEPs here. And one of the things I always remind agents is, if you're not really sure about an SEP, if you do have a paper application or one of the books, I don't have one on my desk, but on the enrollment packets, on the application, there is a whole page just for SEPs or election periods. Study those. Study your SEPs. If you want to increase your income for next year and you want to be in this business as a career, you need to master special election periods. I'm going to say it again because it is that important. If you want to earn more money next year and be incredibly successful in this business, you need to master special enrollment periods. If you're only selling between October and January and you're hanging it up, you're missing the other 70% of the pie. We have agents in this agency that don't even really care about AEP or OE because they sell year round. They've mastered special election periods, and it gives them the opportunity to not get stressed out during the holidays and take time off, in the middle of AEP. And you're like, what are you doing? Well, they sell year round. So this is only a month out of the year that they're not selling. This year was a little bit more difficult to do that, but which brings me to my next point. We believe that the disruption in the benefits and the industry this year, there's been some major changes, and one of those major changes is the prescription drug coverage that's happening. And although it's a great thing for seniors, one of the big pitfalls that the carriers did to protect themselves is create very high deductibles. So when your clients go to the pharmacy next year in January, they're going to get hit with a deductible, which means that they have to pay 100% for their drugs until they're out of that deductible phase. Now, we've never seen that before in Medicare Advantage, but it's on a lot of the plans that you guys sold. Why am I telling you this? Because I think you need to brace for impact in OEP. Let me repeat that. I think you need to brace for impact in AEP. You need to bone up on the prescription drug benefits for Part D and Medicare, because your clients are going to go there and you're going to get your phone blown up because they're like, why am I paying all this money for my drugs now? They think that you did something wrong. Now, it's also another opportunity to connect with pharmacies and other folks that are out there to make sure that you're a resource when they go out there and they're looking for somebody to help them because they went to the pharmacy and they got sticker shock. So this is a very big opportunity, but it's also a way for you to be there for your clients, because these are the things that are going to happen out there as well. So with that, we have a special guest, Carla Albuquerque from ADS is on the line, and she's been patiently waiting here. There she is. Can you hear us? We can see you. Oh, she's looking for the mic there.
I was muted. Yes. Hello. Good morning.
Good morning, Carla. Thank you so much for being here today. And we need your help. We need your help. So we're really excited for you to be here and share the good news. If you can, because it's been a while since you've been here, and we've got some new players on the line. So if you can reintroduce yourself, your company,
absolutely,
and then you can help these guys with their clients, especially when it comes to the chronic condition plans.
Let me change. Absolutely, Justin. Just let me change my view here. I have like 3 screens.
Yeah, take your time.
Here we go. Yeah, absolutely. And I mean, I have actually a slide to share if you like to, for me to do that, and kind of go over. So my name is Carla Albuquerque. I am the account executive here at ADS, supporting agents in Florida. And man, it's been a wild ride throughout this AEP. Like Justin just talked about, I'm already getting ready to help my agents throughout OEP, because the challenges has been the Part D side of Medicare Advantage. Do I have ability to share my slides here, Justin?
Yeah, you should. There's a button there on the bottom.
Okay, sure, perfect. I see it. Window, there we go. So I'm going to go over in details on how I can support all of you. This is really, really cool stuff. I got a couple stories to tell as well. It just happened last week. Can you see my slide?
Yeah, we're good to go.
Perfect. All right, sounds good. All right, so this is our agent support program with ADS. And I'm going to kind of go over in details what ADS is, because a lot of you have not worked with us before. I was looking at the names. I was like, wait a minute. Who has not worked with ADS before? Impossible. No, I'm just kidding. All right, so I'm going to talk about who am I, the new technology for diabetes under Medicare. We'll also help ACA plans now. Justin just talked about that. How the agent support program works with ADS, and how to take advantage of my support like ASAP, like right now. First and foremost, who is ADS, right? We are a diabetes supply pharmacy that works directly with Medicare agents. As far as I'm aware of, we are the only one supplier company that is doing something like this in this capacity, supporting agents to help them grow. We're a nationally accredited pharmacy with Medicare by multiple organizations. We're, up the neck, regulated with HIPAA and Medicare, like you guys are. We have been in business for over 20 years with this industry experience with diabetes supplies. we've gotten pretty good at this one niche. You know, we Justin really talked about as well. You have to be masters on what you're selling. And really, we're not even selling anything at this point. We're needed in the market like you guys are. You are needed. People need you. We've been in partnership with United Healthcare for over 12 years now. So the navigator systems, they come to us, and I got these new members and they don't have an agent. I'm like, what? Impossible. You have to have an agent. So I connect my agents that I work with that location with the member. It's pretty cool what we do here. And so we've been actually also really strong with Aetna for the past 3 years. And I want to talk a little bit about that if you do write in Georgia and Alabama, because I support Florida, Georgia, and Alabama. Excuse me. I'm the account executive working here supporting these agents, right? So if you live in Florida, Georgia, or Alabama, I'm your person. If you write nationwide, for example, you have a client in New York, I'm still your person. But if you live outside of Florida, then or Georgia and Alabama, I have a person for you. Okay, I'm specialized in Medicare coverage. That means I'm your expert on the go, on the field. Like, we have created this whole team just for our agents because you guys have no resources on the field. When you're dealing with clients with diabetes, they're asking all these questions. I'm like, where do I go? Do I go to Justin? No, he has no idea how things are covered. Do I go to United Healthcare? Maybe sometimes, but because we've been so strong with this, you know, I work with the sales director for United Healthcare. I work directly with the market managers and broker managers for Aetna. And so they don't even waste their time. They're like, call Carla. She's a girl. Call Carla, email her, ask those questions, because I do know how things are covered and how things work, right? So this is what I am for you guys. I'm a really powerful tool, resource for improving your retention. We want to make sure these clients are happy and taken care of, and I'm here to be that support for you. My focus for you guys is to improve in retention. Like, this is my whole focus. We do support, we are a whole company focused on supporting our members, but me, myself, and I focus on supporting you to help you grow. So I'm your sidekick for diabetes supplies. Okay. All right. So how this agent support program works? It's pretty easy, but it's really, it gets complicated if you don't understand it. So you meet with clients with diabetes, you're sending their information directly to Carla and her team right away. Why do I say that? I'm going to give you an example. You know, stories are very important to relate to the information that you are receiving. So great example is the idea of support to clients is I have an agent who I've worked with for the past 4 years, and she emailed me, said, Carla, I'm moving my client from Humana to United Healthcare, and oh my God, she's freaking out, I'm freaking out, I'm about to leave out of town. Please help me. Of course, email me your client's information, call the client, and this poor girl, she's dependent on a insulin pump. It's called Medtronic MiniMed 780G. And she's dependent. Her life depends on that pump because of her disability. And she just found out by other supplier, CCS Medical, I'm going to say it because I'm so furious with them. They told her that she has to return her pump because she's moving from one plan to the other. And I said, that doesn't make sense. And I asked those questions, and over, long story short, I spent about an hour and a half with this client because it was really special to me, how she was in trouble. And so we called CCS in a 3-way call, and I said, I'm going to be in the background. You asked these questions. She wrote it down. And at the end of the day, so what happened is the supplier, without her knowing, was entering in a contract with Humana to rent a pump for her, and she's paying $130 for this pump, right? It was a rental pump. And when it comes down to an insulin pump under Medicare, it is covered 80% by all health plans. And I'm going to go over that in detail, but just to have an idea, this woman spent almost over $1,000 on her pump, when it was supposed to be $700, 20% copay for a new pump. And she would have that for 5 years. That pump would last for 5 to 6 years. And now she has to return a pump where she paid over $1,000 for it. So she's going, and she had no idea it was a rental agreement. and now with United Healthcare, she's covered 100% with us. She has no co-pays, which is really wonderful to see. These members are living paycheck to paycheck, and for us to come in and help them and cover them properly and educate them, it's so important. So full service concierge support to your clients. Okay, so that's what we do here. And it's really that easy. So we were finding these clients, you find out, hey, my client has diabetes, call my client on my behalf. And we'll call, making sure that we're calling these clients on your behalf. So you're getting the credit for this service that we do. And it's really that easy. And before I forget, we provide the service for free. I had agents who understands what we do. They're like, oh my God, how much is it going to cost my client? Nothing. How's it going to cost me? Nothing. We're trying to create a value under Medicare because it's so competitive, as you all know. We're trying to create a value. We're spending a little bit of money, in our organization to support our agents on the field and help their clients with diabetes. So yeah, cost you guys nothing. We're now supporting clients under 65. ACA plans is a big one for us this year. We had some agents having some troubles with ACA plans, and we're able to find some solutions for that. So that was pretty cool. We also entered in partnership with Retire Flow. The whole key here of our model is to make life easier for our agents. That's what Retire Flow does. And if you want to know more about it, we have a discounted pricing. They do have a membership for that service, and I can provide you more information individually if you want to. All right, so let's break down how this really works. We're finding clients with diabetes here. As you can see in the data, diabetes is a growing concern. I have never seen so many agents refer clients this year, but never before, because of all the changes that are happening next year. They don't want to surprise us. They want support. You guys are working so hard. You guys are dealing with so many stuff. I mean, breaks my heart to see how hard you guys are working, changing plans, making sure your clients are covered under Part D, especially for the medications that are changing for next year. It's a lot. So agents are really relying on my support and coming and just, please call my client for me. I don't want to deal with this. And that's what I do for you. So we're finding out that 1 in 3 Medicare beneficiaries do have diabetes. So 40% of your book of business do have clients that live with diabetes. So let's find out, how do we figure out who does? Because a lot of agents, especially the new ones, they don't know how to approach it. And you don't want to go, hey, client, do you have diabetes? Yeah, so we're finding out an easier way for you guys to identify so you can alleviate those, start researching for things. So the secret is really asking everyone, do you check your blood sugars at home, right? Super simple. Do you check your blood sugars at home? You're going to find out that, oh my goodness, so many people do. At least they're pricking their fingers every day. So yeah, a lot of people do. I have stories to tell too. I have agents calling me, hey, my client has been denied for strips and it's just paying out of pocket. I'm like, what? Oh, no money spent on diabetes supplies, if that's the goal here, right? And strips for sure. And the reason why a client will be paying for strips, which is that little kit, and I'm going to talk about in details how that works, is because they've been using an old meter. And if they're going to the pharmacy, the pharmacist is not going to say anything. They're going to, oh, this is your copay. And they're like, oh, okay, I'm paying for copays now. No, it's because the plan is now only covering a certain type of brands. I'm going to go over those brands with you, but the reason is they're not educated why. So here we'll say, hey, okay, this meter you love, this is the new meter that your health plan is covering. It's covered 100% under your health plan. And do you want to switch? Oh my God, this new meter, and I live by that meter. Well, I can educate you. We have a whole department of pharmacy specialists that will call the client and educate the client how the meter works, how to set it up, and all the good stuff, because we're dealing with seniors most of the time. So they don't know. They don't know. So it's kind of cool that we can provide that educational service to them. And again, so 1 in 3 clients will have diabetes. And those are the ones that we can call for you. All right, so here's the easiest way to, I'm sure you guys are like, oh, my clients don't want to, anybody calling them. I don't want anybody calling my clients. So we kind of created a special way to tend to that challenge. So we could say, for us, we're asking our agents to talk to the clients and ask permission first, let them know we have a service for them under the new health plan. And the goal is we're trying to provide an educational service where they can obtain their much needed diabetes supplies properly covered, but take full advantage of their plans, you guys, because these clients, they don't know what they don't know, right? It's new information. And I was so surprised. I was talking to an agent. He sent me a list of clients and they're like, hey, can you check to see if my clients will upgrade to the Freestyle Libre so they stop pricking their fingers? When I call those clients, 80% of them have no idea. They were covered 100% with United Healthcare. That was a United Healthcare list. And they would alleviate from pricking their fingers 3 to 4 times a day. How cool is that? They were thrilled. And of course, just sending thank you notes. Agents, I love you. Thank you for setting me up with Carla and her team. And they're super happy. And this is what we want at the end of the day. Happy clients or is happy book of business. Okay, so what does that call look like? So when we're calling your client, we're referencing you by name. Really that simple. Hi, Janet. This is Carla with ADS. Your agent, Aaron Smith, your insurance agent asked me to call you to help you with your diabetes supplies. Boom. Very personal, very easy, no running around, and we're asking the right questions, right? One thing that we're doing now, we're calling, my whole team is calling from one specific number because all the scam calls and all the robocalls that we get, our seniors are getting 50 calls a day and they're scared to answer the calls. So we created and designed one phone number. My whole organization will call the member from this number. 760-827-6243. I also have a 760 area code. It is a California number. I wish I could change it, but hey, it is what it is sometimes. But now members are used to our area code and they know ADS is related to that phone number. So they know we're here to help them. All right, so we talked about the service, how we can refer the client over to Carla and her team, and what we're going to do for your clients when they're referred. We are doing a lot of work behind the scenes. United Healthcare has just started a prior authorization process for type 2 diabetes for their Freestyle Libre and the Dexcom. Oh my God, September was a nightmare. A lot of work on my side, and agents are like, what's going on? Oh, don't worry. You don't have to stress. I got you. It's all taken care of on our end. We're working with the doctor's office, getting this resolved. And it's only a process of 10 business days. Oh my God, my client's going to run out of the sensors. Okay, we got a solution for you. So ADS, as long as the client is with us, and by the way, I think all health plans are going to be doing this prior authorization process for next year, which is a bummer. It's an extra process, but the end of the day, we want our members to not run out of supplies. So we're providing a free sensor on us to those clients that are going through, and those members that are going through the process of prior authorization. Okay, so that's what we're going to be doing. The sensors last 14 days, the Freestyle Libre does, and that will help hold off the process of United Healthcare stamping the deal and approving it. And then we do the insurance verification and of course, properly cover new member, which is one of the things that we shine here at ADS. Well, at least that's what my agents tell me, which is pretty nice. And then we have, of course, UPS shipping the supplies directly to your client's home. All right, so which of these, because we focus, see, we don't do medication here, even though we're a pharmacy, we don't do medication, we do hardware. So we focus on the hardware, we try to master, like Justin just talked about, mastering something that's needed. And so we're mastering on the hardware part of diabetes supplies. And I'm gonna talk about exactly what we're sending your clients, okay? So these are the items that your clients are going to be using when they're testing the blood sugars at home on a daily basis. Here we have the blood glucose meters, the BGMs. These are the two brand names that are covered under Medicare. We have the AccuCheck, which is the old model, and like it's something that members love. It's old school, and then we'll have the new ones, the One Touch VarioFlex. They're both covered under with United Healthcare and Aetna. I think Devoted is going with One Touch. Actually, Aetna is going with the One Touch for 2025. So as you can see, if they're using the AccuCheck as an example, and they're going to the pharmacy and going to get a strips for that AccuCheck meter, and Aetna only covers that One Touch, guess what they're going to have? Copays in error, right? The pharmacy is going to charge them. And when they come to ADS, when we're calling these clients on your behalf, we're letting them know, hey, Aetna only covers the One Touch, VarioFlex, for 2025. And it's 0 copays for you. It is a new meter. Do you want information on how to use it? Do you want help to set it up? And usually they say yes. And now, they're going to get 0 copays with us. You see, the little things make it a big deal at the end of the day. You're not getting those calls, why I'm getting charged for strips, So now you're getting a free, like what I talk about is like a hassle-free experience from the start, which is really important. So if they're using a meter like this, they're going to get a meter, the testing strips, the lancets, the lancing device, and the control solution. These are covered under Part B, you guys. Bravo. So sometimes the pharmacy will try to cover them through Part D. Again, copays in error. You see, so those little things, kind of important to know, for at least for you guys. It's basic information, but the work for us to get it done. At the end of the day, we wanted to do all the work for you. And here's the exciting new technology that clients are thrilled about. They want it. They've seen it in our commercials. They want to know more about it. These are called the CGMs, the continuous glucose monitors. We have the Freestyle Libre 2 and the 3 now. And we have the Dexcom G6 and the G7. The G6 is actually being discontinued. We're going to be offering our members the G7. It's compatible with the most insulin pumps. I'm going to go over that in details for you. So yes, these are the sensors that you wear on the arm. Amazing technology. Some members that I talk to, they say it's a life-changing for them. They're actually being able to share that data with loved ones, family members. And I'm going to talk about a little bit in details of why one of the data is really important, because it is one of the qualifications under Medicare now. So these monitors that are really wanted by the members are mostly 0 copays for 2025, which I'm really excited about. If there's 20% copays, it's $50 per month. But I really believe everybody's being competitive for 2025, and they're going to be covering these CGMs 100%. Yay. All right, so these are covered under Part B as Bravo as well. And this is the data that I talked about. Some of my members are hypoglycemia. So under Medicare, even though the plans were covering this CGMs, the Freestyle Libre, the Dexcom, 100%, there's still qualifications for coverage. One of them is the client must be injecting insulin 1 time a day or having hypoglycemic events of 54, 55, 58, around there. About 30%, almost 40 now, % of my clients, my members, have hypoglycemia, which means they're fainting. The sugar goes so low that they faint and they fall down and end up in an emergency room. So those are the other qualification on Medicare. And so I had one member just talk to me a couple of weeks ago, and he said, Carla, my Dexcom is my life's changing, and I'm able to share an alarm with my son. And when it's low enough, my son comes and rescues me, because, you never know what's going to happen at that point. And these members have to live with this. It's crazy. But, we got cool technology. My stepdad had diabetes as well, and he passed away from it. Had a heart attack and passed. He didn't want to prick his fingers every day. And Libre and the Dexcom was not around back in the day. So that's my personal little experience for you. All right. So isn't that crazy? Like, how cool is that? You have a sensor that you wear on the arm. You got a little pump. Now no longer you have to prick your fingers every day, and you don't have to daily inject insulin as well. This is to work together as a closed loop system. Here's a Freestyle Libre 2 Plus sensors. It's the new product for 2024 and 2025. And the T-Slim, they both work together, and the member no longer has to stop, multiple times a day to test the blood sugars or inject insulin as needed. Very, very cool technology. All right, here is the insulin pumps under Part B. We have the Medtronic MiniMed, and we have the Tandem T-Slim. And the supply, so a new pump like this is expected at 20% copay for all health plans, unless the member has Medicaid, right? Then it will be covered 100%. If the member has Medicaid, he will not have copays for any of this stuff. All the supplies under Part B is covered 100%. All right, so the pump, if you want a new pump like that lady that I talked to you about, like, last week, the top pump is what she had. She expected copays for 2024 was $700 for a pump like this. $700, and you have monthly payments too, which alleviates for our seniors. But a pump like this will last 5 to 6 years. So you're paying $700 for a new pump, and then you have it for life. Not the story that you heard about Success Medical charging a client, a rental agreement. Oh my God, that killed me. I was so sad. Okay, and then the supplies for that pump under Medicare are covered 100%, you guys. So if your clients could tell you that they're paying co-pays for supplies for the pump, which is the reservoir and the tubing, the infusion sets, it's wrong. It's covered 100% on Medicare. Okay, and then we have the CGMs that are connected with these pumps. We have the Freestyle Libre 2 Plus sensors and the Dexcom G7. They work with the T-Slim, and then we have the Guardian 4. Guardian 4, so if a client is using a Medtronic pump, the Guardian 4, as you can see here, it's a little thing right here. Horrible. I don't like it because I have a lot of complaints. But the Guardian 4 is the only CGM compatible with the Medtronic MiniMed pump. And most insurance won't cover it. United Healthcare so far is the one that's covering it 100%. And then if you have to deal with, clients with Aetna, for example, we have to do a prior authorization. Still covered, but it's just a little longer process. Okay, there's a lot of crazy things behind the scenes, huh? And if you don't know about diabetes, you're like, oh my God, it's too much information. But I wanted you guys to have an idea how things are, what your clients are using, how things are covered. It's really important to know. So here is a Part D items. It's the only Part D diabetes supplies that is dispensed to your clients. So we have the Omnipod 5, very popular insulin pump. This pod, you can use it up to 3 days, and then you toss it out. And that's why it's covered under Part D under Medicare. Members want it. They love it. I'm really excited to see what's going to happen for 2025. I have an idea with United Healthcare because we're work really closely with the leadership team. But with other plans, I have no idea. So we're going to have to do our insurance verification on the 2nd and let our agents know how that's going to be like, and the copays and deductibles like Justin talked about. It's almost considered as a medication. But the health plan will only cover it if you see it on a formulary. So if you're looking at the formulary and you put in those medications in there, you have to put Omnipod 5. And it will probably show Omnipod 5 kit with the Dexcom G7 because they work together very well. And we'll also have pen needles and syringe needles and the syringes, so forth, and then the alcohol wipes. You'll be surprised that we see copays for needles. That drives me crazy as well. And so we actually have a Medicare program with ADS here, and it's really focused on covering those little copays for pen needles, for example. And so at the end of the day, we want to make sure that these members are covered 100%. It is pretty nice. Little things go a long ways for our seniors because they live paycheck by paycheck. And here is pretty, I talk about the Omnipod all the time because it's pretty amazing. As you can see here, you can put it in different areas of your body. It works together in correlation with the Dexcom G7, and you can just run around. For 2024, we had the donut hole. I had a member who was actually paying $1,200 in September because you got a good copay, like $141 for the first initial dispensal, and then it goes up because of the donut hole. Well, that's going away for next year. So I would say if a member one of your clients is using the Omnipod 5, they're going to hit the 2,000 cap for next year because it's covered under Part D, right? And I think, dividing that by 12, I would say co-pays would be around 167, including the insulin, Omnipod, and medications, which is kind of nice. I'm excited about to see what's going to be unfold for the 2025. All right. Yeah, that was a lot of information. You guys are like, what? Hopefully this is recorded. You guys can review this later. I'm trying to rush a little bit for the sake of time. But if you have clients with diabetes, please don't wait until the first, you guys. We are here to support you guys. We're going to call these clients on your behalf to make you look good, make sure they're taken care of. And this is what we do for you for free to help you grow. Okay. Because if my agents are growing, we're growing too. It's a win-win for everyone. It's awesome. So how do I start today? You're looking at your book of business. Some of you, of course, have gone through AEP without my support. I have no idea how you did it. Bravo to you. Congratulations. But here, you're looking at your book of business and you're going to check, okay, I have 3 clients with diabetes. What plan are they under? How I can send this over to Carla? This is what I really kind of try to train my agents to do, because I do this kind of presentations for all the health plans. We are in a work with everyone by Humana at this time. We got a contract with Humana for 2025, but only for a few states. We're doing a tryout. See, I'm crossing my fingers because I have a lot of my agents in Florida write Humana, but we're in a work with everyone. So if you have a client and needs my support, here's the way to do it. You can scan your phone and the QR code will send you to my page. We are regulated with Medicare and HIPAA up to the neck. So we created a portal that's secure. So you can actually be at peace that your information, the client's information that you put in there, and sometimes the clients will do that too. They just fill out their information, put their agent's name, because I want to connect the client to you. That's the goal too. And you can use this little form to send it. So I receive it on my inbox, and my team will also receive it. So if I'm doing a health plan and like a training like this, which I do on a daily basis, then my team will receive it as well. But I'm always checking on that inbox to see who is coming over and what agent's referring. And here's my information. This is my cell number. You can text me on this number as of now. And if you have not worked with me before, be ready for OEP. You're going to need my support. And you can text me right now, your first name, last name, and phone, in email. And then I'll be able to send you my intro little template as an email, and also send you a box of goodies, because I can do that marketing support for you on the field. And it costs you guys nothing. It's pretty cool. Wonderful. All right. Thank you so much, Justin, for having me over.
Yeah, Carla, thank you very much. And that was incredible. Thank you for getting us up to speed. There's a couple questions in the chat here. Can you mention the carriers you're covering? I know you talked to Tina that you don't have Freedom, but can you list all the carriers that you currently work with?
Absolutely. Yeah. So we are partners with United Healthcare. We're very strong with Aetna. We were with Florida Blue, WellCare. What's it called? Baycare?
Baycare, yeah.
Yes, Baycare now. For ACA plans, by the way, we're in with everyone. So you don't really have a pick there. We are in network with everyone with ACA plans. But yeah, that's pretty much it right now. Oh no, Gold Kidney. How can I forget? Gold Kidney's been we are entering in partnership with Gold Kidney. We have already, but 2025, we're so strong with them. I've done a lot of training for their agents, and they are on fire. And so they are going to utilize ADS for their diabetes, wing.
Perfect. Yeah, one of the questions was, is are you in contract with Ambetter? And so you answered that question there. So
yes,
thank you for that. You've got a fan base in this chat, by the way, if you're not looking at it. But Lorna's asking, do you have anyone that speaks Creole Haitian?
Yes, great question. We have a service. Isn't that great? I have a few agents who are Koreans, and they're really pitching into this culture, and we have a translator service in the house. Yeah. Great. So if you do have a community of different languages, we can provide we will call the client with a translator service.
Awesome. And then Colleen's asking,
And Cigna too,
Cigna,
of course.
Okay, good.
Yeah.
Good. Okay, great.
Yes.
Sonia's asking, do any of the plans that you serve cover the injections? Not sure.
So you mean the injections mean the medication, or do you mean by the needles?
I'm not sure, but I'm assuming she's probably talking about the syringes and things like that.
Yeah, so I would say, depending on the plan, it's not even the health plan. It's just a weird thing that comes up with the specific plan on the region. We see co-pays for like $60. Are you talking about the medication itself? So
Yeah,
no,
so Monjura and Ozempic is what she's referencing.
That is going to be specifically Ozempic, let me tell you, because I like to research. We don't do the medication here, Sonia. Right. I just work with my agents. We do some searches together because I like to learn new things. And I'm seeing Ozempic really having a challenge for next year. Yeah. And if the member, your client, really wants the Ozempic, the process would be kind of the same. What I do with, for example, for the Freestyle Libre is a prior authorization. You work with the doctor's office and get a prior authorization with, medical needed, notes from the doctor, and submit it to the health plan. And then if they want to approve it or not, that's on them. But you'll have to do a prior authorization, submitting with the doctor's office, working directly with the doctor's office.
Mm-hmm. Last question here. I know you mentioned Humana. Does that also include the PPO product?
Yeah. So for Humana, the only contract we'll get for 2025 is PPO. So if you have a HMO Humana, it's a no-go with ADS as of now. It's their choice, not ours. Yeah.
Perfect. Well, thank you for going over time and giving us this great information. We really appreciate it. Many of you were asking for her phone number. It's on the screen there, 760-524-3450. And then her email is there as well. I put that in the chat. You said something very interesting that correlates to our business. She just shared with you a secret weapon. All you have to do is ask, do you check your blood sugar at home? And right then and there, you have an SEP for our chronic condition plan, which allows you to sell year round. And then you can connect that member with Carla so they can get an incredible support on their diabetic supplies. So it's a win-win situation. It makes you look like a hero, and that's what it's all about. So Carla, thank you very, very much for your time and attention today. We really appreciate it.
My pleasure. Have a blessed day, everyone.
Thank you. You too.
Bye-bye.
All right, everyone else, we are good to go for next week. I know we're running into the holidays, but just know that we're going to continue these calls on Mondays for the rest of the year and into 2025. So if you have anything that you might need between now and then, please remember that you've got support at askhpm.com or give us a call at 844-696-3975. Thank you, guys. I'm wishing you a great and productive week. And if I don't talk to you, happy holidays. Thanks.